Agata, thanks so much. Great to be here. I know I have been in many of these sessions before, and every time I've been in these sessions, I have been here in my capacity as the faculty director of InnovateUS, and I am here with a very different capacity because we all wear many hats, and I have another hat that I help to lead the City Health Dashboard, and I am so glad to be here to talk to you about it today because health data is critically important in many different ways. And this conversation is going to get at some of the nuances of data, how we've tried to make data more accessible and relatable, and the differences between data that's collected at different levels of government. So we talk a lot about geographic sizes, and we are just pumped to get into it. So I will quickly say that Sammy Breslin, who has been my longtime colleague at NYU, is joining me. She is a program supervisor with the dashboard and leads all of our engagements. So she is going to be leading a lot of the presentation. But I want to just start a little bit by saying, and we don't usually do this, but the origin story, the data origin story of this initiative. And right now, the dashboard is about 8 years old, but the history of this goes back quite a bit before then. And it really originated, and this might sound strange, it really originated with the bankruptcy in Detroit, Michigan. If I'm sure most of us remember that. And at the time that Detroit slipped into bankruptcy, the Obama administration, takes a little while for us to remember back there, got mobilized. And as someone who has been looking at local policy for decades, it was incredible to see a presidential administration at least have recognition of what was going on in a city. And the Obama administration put together a great team of administrators and secretaries from different agencies that went down to Detroit to try and be helpful. And wow, were they shocked. Not so much at everything that was happening in Detroit, but just around municipal finances and municipal conditions. And so they put together a really interesting program called the National Resource Network that had $10 million to help future Detroits, meaning to help about 40 or 50 other cities that were on the precipice of fiscal collapse. And I was a part of that program through New York University. And I'm really an urban policy researcher and technical assistance provider, and also do a lot of work with state governments. And so my role in that capacity was very much as a generalist, meaning like going to different cities around the country, like New Orleans and Dayton and Compton and Los Angeles. I mean, it's hard to remember. There were so many of them, so many cities in need. And we would always start the conversation by saying, tell us what your priorities are. And not surprisingly, a lot of times what we encountered were things like overtime costs with the uniform services. But one of the things we heard again and again and again from mayors, from city managers, from commissioners, was they did not understand health. They didn't understand health in their own city. That was incredible to us. And more than them not understanding it, they desperately wanted to understand health because of the opioid crisis, as we've seen with COVID now. There are so many reasons that local governments, municipalities need to understand what the picture of health is in their city, in their community, in their neighborhoods. And incredibly, we discovered through this process something that health researchers know very well, that health data is not collected at the municipal level. It's collected at the county, the state, and the federal level. And so at that time, I walked over to the new population health program at New York University, Mark Goreyevich, who was the founding chair of that program. And I said, we've got to do something for America. And we have now, Sammy will tell us more about it, created probably the largest, most consistently updated platform for municipal health data in the United States. In a way, it functions a bit like a federal agency that is consistently updating data. And for those of you representing county and state governments, you know well this is incredibly important for you because it puts you in a position to better understand what is happening with municipalities. Again, that data had not existed before. So with that very humble OG origin story of the dashboard, I want to hand it over to Sammy to walk us through more context and specifics about the dashboard.
Thank you so much, Neil, and for grounding this presentation in our history. It's always good to be reminded of where we started as I, in this presentation, talk about where we are now and where we're going over the next few years. Let me just swap the slideshow. So as Neil stated, my name is Samantha Breslin. I'm the program supervisor of the City Health Dashboard, and we are a free website, cityhealthdashboard.com. And our team, our goal is really to support data-informed approaches that help cities, towns, villages, boroughs across the U.S. Thrive in health, well-being, and opportunity. And as academics, and I'm sure everyone on this call knows, progress is powered by local communities, but it needs to be guided by data and grounded in data. And cities really do play a vital role in shaping the health, well-being, and equity outcomes of their residents, whether that comes to affordable housing policy, smoking policy, access to healthy foods, the built environment and zoning laws, public safety, and the list does go on. And with better data, users can make a stronger case for policy change and for new approaches and programs. So if you're thinking about, what new zoning laws could look like in your city or in your community, you need data to help you make the case for those things. So in comes the City Health Dashboard. Neil, mentioned that we were founded in 2018. And we were founded really to meet this need that we saw that cities had, was that there was just a deficit and a lack of data that was aggregated or disaggregated to not only the city level, but down to the neighborhood or census tract level. And our site, it's a free website. You don't need any sort of, username, password. There's no paywall. Everything is freely accessible. At cityhealthdashboard.com, and I put the URL in the chat just earlier, but our site provides over 45 measures of health and the factors that shape health for roughly 1,200 US cities and growing. So any city that has a population of around 50,000 and larger is automatically included on our site. But every year we're adding smaller and smaller places to the website. And every year we're also adding more metrics to the website. So just because there's a metric that's not on there now, doesn't mean that it won't be added in the future. And our partners have been invaluable in helping us shape the tool, build the tool, and iterate on our website as these 8 years have gone on. So I do want to thank our partners, ICMA, NLC, and NACCHO, and perhaps some of you on this call are familiar with these organizations, but these organizations were our lifeline into local communities. Like I said, like Neil said, our team is based out of NYU School of Medicine, and so we're academics. And so when we were building this site, and our goal was to make it as user-friendly, as accessible as possible for really anyone. But in order to do that, we needed to have, voices from cities on the ground. And we fed all of that feedback, all of those voices into our website development. And as we've managed the tool over the past 8 years, that feedback has been and remained invaluable. And what is the power of the dashboard? What can you actually do with the dashboard? So first, you can pinpoint the various social and economic influences that contribute to healthy and thriving communities. If you want to make changes and you want to improve outcomes in some areas, you need to know what areas are doing well and why are they doing well. The dashboard is also useful in helping you spark collaboration, particularly across sectors or across industry or across departments, and helping you create those cross-sectoral interdisciplinary partnerships. And it also can help you take action so that everyone has the same opportunity to live a long, healthy, thriving life. And we didn't want our site to just be, this staid, boring data website, similar to what you get, from the federal government. We wanted it to be to motivate and inspire and empower people to actually take that next step and use the data and put it into practice. And who are our main audiences? So we see our audience as being quite broad, but our sweet spot is mayors and city managers, but also their staff, local health departments, other city government agencies like housing agencies, community organizations and nonprofits, health and education advocates, foundations and other philanthropies, researchers, and the media. And the strengths of the dashboard, at a glance are that, and Neil alluded to this, all of our data is accurate and reliable. We are academic. Having that reputation is one of the biggest parts of our mission. Our site is easy to use. I mentioned this, it's accessible, and we see it as a one-stop resource for cities and communities nationwide. And like I said before, it was developed and tested by community and city leaders. And this slide is a good, it's a good entry point into potential use cases of the City Health Dashboard. So when you come to the site or you come to your city and you're looking at, a map of, let's just say, life expectancy in Columbus, Ohio, the dashboard is useful in helping you identify health metrics across different neighborhoods. I pulled out 3 different census tracts here in Columbus that have very different life expectancies that range at most 20 years. So imagine living in one neighborhood and having a 60-year life expectancy, but the folks living in the neighborhood less than a mile away can expect to live 80 years. So the dashboard's useful in identifying where gaps or disparities may lie. It's also a good tool to help you compare your city to cities in, your state or the region that you live in, cities that have a similar population size or demographic breakdown. And then it's helpful in terms of helping you set priorities and better guide scarce resources. And a note about our measure selection. So like I said, we have over 45 different measures, but all of our measures come from national data sets and reflect the most rigorous methods of data collection and data analysis. And we didn't want to just provide data for data's sake. We wanted the metrics and the data that we had to reflect changing city level priorities and be amenable to intervention. So if we had data for something that could not be changed at the city level, but could be changed at the state level, we're not adding it to our site. We're only adding information that is directly modified at the municipal level. And as Neil mentioned, our data is updated regularly. In a perfect world where there's no government shutdowns and there's no, messing around with federal agencies and all of that, all of our data is updated on an annual basis at a minimum. And then we also wanted to make sure that our metrics represent a comprehensive, well-rounded view of what influences health. And we take a pretty clear social drivers of health stance when we were thinking about our metrics, which you can see here. So all of our measures are balanced over 5 domains. So you have your traditional health outcomes, social and economic factors, measures that relate to the physical environment and health behaviors, and then finally measures that fall under clinical care. And all of the measures that are listed just with Navy are available at the city level, whereas the measures that have that light blue or gray background are available at both the city and the neighborhood level background. So you can see that most of our measures do have that, that sub-city level of data available, so down to the census tract level. And then any metric that you see that has that diamond icon also has demographic data available as it's available from the data source. So we have race, ethnicity breakdowns, age breakdowns, and sex breakdowns. And so let's pivot quickly to the website. I'll just do a very quick demo for the sake of time. So like I said, cityhealthdashboard.com, you come right to the homepage here and you're asked to put in your city. I'm going to do Jackson, Mississippi. And you can see all of the different measures that I just showed you on that previous slide listed here. And you can dive into any of these to see more information about any of those measures. But you also can view, Jackson, Mississippi overview and see at a high level how Jackson or your city is doing across all of our different measures. You can open up any of these to see more information about how we measure that metric, a thumbnail of the map. We provide what we call these sense-making statements, which tell you in plain language how your city is doing or how your neighborhood is doing for all of our different metrics. So we provide both visual cues and also language cues to help orient folks to what they're seeing. And again, meet people where they are. Some people learn better by looking at visuals, others learn better or comprehend better by reading in words. So we want to meet people where they're at. And we also have notes about the data source and all of that. You can also see we have very disaggregated demographic information at the city and the neighborhood level. So you can see not only what percentage of your population identifies as Asian, but you can go even deeper than that and see what population identifies as Chinese versus Japanese versus Korean versus Pakistani. So down to that subgroup level. So if we just go Asian, you'll see the map populate where the light green neighborhoods tell you where there's low concentrations of a population, and those deeper green neighborhoods tell you where there's a higher concentration of that population. And so again, you can go East Asian and the map will change, and then you can choose, for example, Korean. And hold on, let me just choose Chinese. And you can see here that 2.5% of this neighborhood identifies as Chinese. And so what this information provides is just more context about who are we serving in our community and how do we serve them in a way that's sensitive and resonates with that community. So does that mean that we have to be translating our documents or translating our service delivery method? Do we need to be partnering with community leaders in that community in order to better target and better reach sometimes underrepresented folks in government or in whatever you're focusing on? And so moving on to the metric detail page, I'm just going to highlight for this demo, children in poverty. So across all of our metrics, what we call the metric detail page, or the various pages and features of our website, once you understand, the way we talk about things, the way we visualize things for one metric in one city, how we do it for every metric, every city combination. So you can see here this scale bar, this like teal scale bar, which represents the range of values for that metric in that city. And across all of our metrics, lighter colors indicate better outcomes, and those deeper colors or deeper blues indicate poorer outcomes. And so for a metric like children in poverty, you of course want less of your children living in poverty, so your better outcomes are going to be at the lower end of the scale. Whereas for a metric like high school completion, for example, you want more of your adults or more of your population, your residents, completing high school or getting an equivalent degree. So the better outcomes would be on this side of the scale, the higher end of the scale. This blue triangle represents the average of the dashboard cities. So like I said, we have around 1,200 different cities in the website, and that's what fuels that average. It's a proxy for a national average, but it's not quite one-to-one because we don't have full US population on this site. And then this gold bar tells you the city value for that metric. So in Jackson, Mississippi, roughly 49% of children were living in poverty in 2023, as compared to 17% across the dashboard cities. So children in Jackson, Mississippi are doing worse than children, nationwide. And then going down into the map, which is, my favorite part of the website. So all of these different census tracts approximate neighborhoods in Jackson, Mississippi, and you can see at a glance which neighborhoods are doing better and which neighborhoods there's some room for improvement. So, this neighborhood here has 0% poverty. This neighborhood in the northern part of the city has 9% poverty, but in the city center here, there's 100% poverty. And then in this neighborhood, there's 70% poverty. So there's real gaps that, I'm seeing, or that we're all seeing here at a glance. And these maps are useful for helping identify quickly what patterns may exist, or where we might want to, focus our attention or focus our resources. You can also, for around 1/3 of our measures, like I said earlier, you can see the data broken out by age, race, ethnicity, or sex, depending on the data source. So for children in poverty, you can see all of the data broken out across the 5, or not, there's insufficient sample size of Asian children in Jackson, but across the 4 other major racial ethnic groups, you can see how they're comparing across each other. So you're able to take that equity lens, not just a geographic, or the racial equity lens, not just a geographic equity lens. You can also compare your city, like I said, to other cities. So I can maybe do other cities in Mississippi. I could do Hattiesburg, Mississippi, and then when I put that city in, I'll see their scale bar with their children in poverty rate as compared to mine. But also you can use the dashboard to help you find good comparison or peer cities based on various criteria that make sense to you or are meaningful to you. So perhaps you want to see cities that have a similar population size. And as you click more and more of these different criteria or characteristics, the list of cities that match that criteria gets whittled down. So you're really only identifying the cities that have that best that best comparison to what you're looking for. So you could do cities with in a similar population band. You could do adjacent states, and 2 cities came up. Let's click Lafayette, Louisiana. We clicked into Lafayette. Now Lafayette's scale bar is pulled down below Jackson. And so this is useful because it tells you, it allows you to benchmark your performance or the experience of your residents. And perhaps this makes you want to reach out to someone in Lafayette where they're clearly doing a little bit better on this metric. And because you know that Lafayette is in a similar population size, it's a similar location, perhaps there's some economies of scale, or there's some learnings that can be applied to the Jackson situation or context. You're not comparing, Jackson to New York City when the population is very different, customs are different. So it's helping you get to apples to apples. And then comparing metrics, we all know that a lot of these big challenges that cities are facing today, or that the country's facing today, don't operate in a silo. They're very intersectional, and they're related. And so we wanted to give folks the ability to see 2 metrics at once, to be able to identify how different challenges may or may not move together across neighborhoods in a city. So if we're looking at children in poverty, perhaps we want to also look at rent burden, which is the percentage of households where 30% or more is being spent on rent and utilities. And so you can see the same map of Jackson, where those blue shapes or those teal shapes represent children in poverty, our original metric, but now you're seeing those pink or red dots on top of those neighborhoods, which tell you what the rent burden is of those census tracts. And again, lighter colors indicate better outcomes, darker or deeper colors or deeper reds indicate poorer outcomes. And as you might expect, you're seeing in some of these neighborhoods, where there's lower poverty, there also tends to be lower rent burden. And where there's higher poverty, there tends to be higher rent burden. But, what's interesting and what's, good about these maps is that you're actually able to see, where our expectations might not actually align with what's happening in reality. So for example, this census tract, which has high poverty, seems to have quite low rent burden. And could that just be it could be an anomaly, but it could be perhaps families in that neighborhood are taking advantage of various resources from the state or the city to help them supplement their rent or supplement income. Maybe they're applying for low-income housing tax credits that helps lessen that burden. You don't know, but we would have to do more digging and talk to people on the ground, but this is a good first step at helping, start those conversations and dig deeper into what could be causing the experiences that our residents are facing. And then finally, before going back to the slides, I do want to just highlight that we have what we call impact stories, but case studies or use cases of local communities putting this data into practice. And how they've done that. What challenges were they using the data to solve? We get a lot of questions from users about like, how are other, local governments using the data? How are other health departments using the data? And this is a repository of those stories. And so with that, I will pivot over back to the slides and highlight a really exciting new project that Neil and I have been working on for over 2 years now. This is a playbook that we published earlier this year. It's actually formally getting launched and released, nationwide next week. But it is we have been working on this what we're calling like this data playbook to help cities turn local data into action. And the playbook is called Measuring What Matters, a city-focused guide to health data and change making. We didn't want this report. It's like a report, but it's not, in that it's really practical, it's hands-on, it's written for humans, not for academics, and it's meant to be like a toolkit or a guide that city leaders can use to start making more data-driven decisions. And so what is the playbook? So like I said, it was developed by our team, the dashboard team, along with Neil, to help cities and organizations use data for health equity. And it's hands-on, but it's designed to support cities really no matter where they are in their data journey. But as they're looking to integrate data into their workflows, into their project management, into their policy making or their program design and implementation, and support them where they're at. So if they're really at the beginning, we have worksheets and tools that those cities can use. And if cities are a little bit more advanced in their journey, we have resources for them as well. And all of this was adapted from learnings that Neil and I had gained from this data challenge, which is a cohort that we put on for roughly 18 months that brought together 10 cities from across the country. And it was really focused on improving local data literacy and capacity. So all of the learnings from that, the best practices that we gained, are what drove us to draft this playbook and what the content is based on. So we wanted it to be, or we hope that it is, that it resonates with users across the country. So what does it provide? It provides guidance on helping you define your problems and then scope out what your goals are. What we have found is that a lot of times cities are not really clear on what the problem is. They sometimes think they know the problem, but when they actually dig into it and start peeling back the layers and asking why, they don't have a good sense of what the problem that they're trying to solve is. And then from there, they don't know how to, level set and right size their policy goals because they don't know what they're actually trying to solve. It also provides steps for identifying the right metrics to benchmark your progress and measure your success. So once you have that problem identified and defined, what are the different data points that you need to get a sense of what your baseline is and where you're hoping to go? We also provide tips for building clear, actionable project plans, getting clear on, who are the stakeholders that need to be involved? What data do you have access to? What are the gaps that you have? What capacity do you have on your team? Do you have financial resources, but not staff resources? And really getting clear on what is the landscape that you're working in. We also have tools to help you frame data within a compelling narrative. What we have found is that data for a lot of people, you lose them because it's numbers, it's cold. Data is most powerful when it supports the lived experience of the residents that you're serving with your program or your policy. And having both really brings it home. But just having one, you lose people. And then finally, we provide, as always, we like to provide real world case studies of how other communities are putting this stuff into practice. And then just some key takeaways from the playbook that I think are worth sharing here before we get into Q&A is that you want to start with a clearly defined problem. You want to, before building, collecting data or building data dashboards, you want to use existing tools and not try and reinvent the wheel when you don't need to. So for a lot of what we learned from folks when we first started the challenge was that they all wanted to build dashboards. They all wanted to go out into the community and collect all of this data. But a lot of the communities that we work with, at least, did not have the capacity to do that. It's really, really hard. It's time intensive. It's labor intensive to collect local data, to analyze locally collected data, to build data dashboards, and then manage them and have them be, living, breathing resources. When a lot of the data that these communities were looking for was available on the City Health Dashboard. We do all of the work for you. We're free. We're always changing. We're always updating, and we're making sure our site is, when there's bugs or errors, we're fixing those. We're fixing those issues on a regular basis. We're updating our visualizations. We're doing all of that hard work for cities, and all they need to do is just come to the website and know what they want to look for. And then third, engaging diverse voices helps you shape your data narrative. And diverse voices could mean different community members that you work with, different sectors. So we had one city that was working on a workforce development program, and it just wasn't really catching fire. And then they realized throughout this data challenge process was they weren't reaching out to, they have a big local community college in the city. They had not ever reached out to the folks at that community college to see, could they, provide any expertise or any resources to engage young adults in their programs. And so through that, they, made those calls and made those connections to the administration at the local community college, and it completely changed the game in terms of increasing engagement in various workforce development programs, and also recruiting students and recruiting folks from across the community to join these this flagship program where the city was partnering with a very large transportation agency to provide new jobs. And then finally, some of the key takeaways from the playbook was that it's really important to align your data work with your team's capacity and goals. Your progress is only as good as the team that you have going for you. So if your team is really on the early side of data literacy and data-driven decision makings, make sure that you right-size your data work with what your team's capable of, because there's nothing that kills these projects or kills your goals than, bad morale or, failures on that first attempt. What we always say is take bite-sized steps forward. Get some smaller key successes under your belt, and then use those and leverage those for solving bigger problems and creating bigger solutions. And then I just have a list here of all the different tools that you can use in the playbook. I will put a link to the playbook in the chat just after I stop sharing. But we have a tool that helps you explore the City Health Dashboard website. It does a lot of what I did in the demo, but it's kind of like a choose your own adventure worksheet. We have an assessment or a worksheet that helps you decide or helps you narrow down what sort of data sources you need and what sort of data sources are best for your problems or your solutions. We have a tool kit that helps you build or helps you consider what building a data dashboard could be. And then we have a project planning or project management template. And so with that, I will just stop sharing. I see that there's a lot of stuff happening in the chat. And we have about 20 minutes left for Q&A. Neil, do you want to say anything while I just kind of look through these comments?
No, that's a great summary, and I've been looking through the comments and Sammy, if you're up for it, maybe I could just pose a couple questions to
Yeah,
you because you might be
that's
better
great.
placed to answer than I can.
Yeah.
And as I'm saying them, if we have mischaracterized your question, feel free to unmute and let us know. But we have one question, and I'm going to extrapolate from this and make